Mr. Jones. My name is Bailey. I'm going to be your student nurse today. Can you go ahead and identify your name and date of birth, please? I would also provide patient privacy. Patient identified that he is who he says he is. I would check it with the MAR. So what I'm going to be doing today is I'm just going to be changing your dressing and cleaning your inner cannula. If you have any questions throughout the procedure, go ahead and ask. So if needed, I would hyperoxygenate the patient if indicated by adjusting it. So I'm going to apply clean gloves. Okay. I'm just going to kind of look at the area, make sure it's okay. I'm going to auscultate the lungs, and I'm going to apply the pulse ox throughout the procedure. Okay. I'm going to remove the oxygen, and then I'm going to take. I'm going to take. I need to open this, so I'm gonna apply. I understand I messed up, so I'm gonna open this. I was like, hold on, this isn't right. Okay. I'm going to open my saline solution and pour it into there. I should just replace it, right? I'm gonna leave the cap off in case I need more. I'm gonna look at it. I'm gonna take off the oxygen. And then I'm going to take out the inner cannula. And then I'm going to reapply the oxygen. I'm going to drop it into my normal saline. And then I'm going to remove my clean gloves and then now apply sterile gloves. So these are my sterile gloves.
I would set the oxygen back to normal rate. I'm going to listen to lung sounds again to make sure they sound better.
And then I'm going to put this over the patient in case there's any spills. And if I broke sterile field on it, I would identify that and get a new one. Okay, I'm going to pick up the inner cannula. And I'm going to clean with the brush. Attached to this stuff. Okay, I would have broke sterile field here by this all getting there, so I'm just gonna move it back. Sorry, I would have got new gloves. So I'm gonna pick it up. Okay, this is. I'm gonna pick up the inner cannula, holding the. I'm holding the outer. This stuff keeps getting. Okay, I'm holding the outer edge of it. I'm going to clean the outside of it with the normal saline, and then I'm going to clean the inside of it, and then put it in there. I'm going to rinse it with the normal saline, and then I'm going to make sure there's nothing else on there. If it needs to be cleaned again, I will. Then I'm just going to remove it with my dirty hand, the oxygen, and I'm going to place the inner cannula back in, and then make sure it's locked. And then put the oxygen back over. I'm now going to clean. So I'm just going to kind of assess. I'm going to remove the dirty gauze from the trach. And then I properly dispose of this. And then I'm going to grab the swabs that are in normal saline. And I'm going to clean around the stoma in circular motions and around moving in the outward direction, trying to keep the oxygen on as much as I can so the patient can breathe. After I clean that, then I'm going to apply the new gauze that is sterile. I'm going to put it underneath this, which is I'm gonna put the oxygen back on. I'm going to verbalize that I would remove the Velcro tie and put the new tie on, making sure I can fit 2 fingers underneath so it's not too tight. I'm going to kind of clean up my mess. Then I'm going to take the pulse ox off, and then I'm going to auscultate the lungs again. I'm going to make sure the patient is in a comfortable position with the side rails up and the call bell in there. If I hyperoxygenate it, I'll put it back to baseline, and then I'll document how the patient dealt with the procedure, if there's any secretions, what they look like, how much, what their consistency was, and how the stoma and the outer cannula looks. I would also dispose of my gloves and perform hand hygiene, and then ask if he needs anything. The call bell is next to him.